Hello, everyone, and a very warm welcome to the Be Conscious Wellness platform on the Playscape Knowledge Hub. As you can see, there's quite a few of us gathered around today. And what we want to do is we want to talk to you about intensely personal experiences, about our intensely personal journeys that have led us to where we are today on the path to living lives that are empowered, that are full of fluidity, and that are full of freedom. So we have quite an impressive lineup for you today. Let me introduce you to my fellow panelists. Deepa Masand is joining us from Bangalore today. Deepa has been practicing the lotus meditation for 18 years now, and she joins us today to share how her practice has affected self-growth, self-empowerment, and what that journey has been like for her. Deepa, thanks for joining us. We also have Jessie. Jessie is joining us all the way from Boulder, Colorado. Jessie is actually the content writer on our website. And so those of you who haven't checked it out already, I encourage you to do so. There's a lot of resources over there for anybody who's on this journey. And Jessie certainly is someone who spent a lot of her career developing websites such as these for people that are either coaching. But Jessie joins us today not to talk to us about her work, but she's talking to us about how her professional interests actually impacted her personal choices in terms of this journey she chose to undertake. And I look forward to hearing some more about that from you, Jessie. And then, of course, we have the Gulatis who join us. Tanu and Dr. Sanjeev Gulati are joining us from Charlotte in Richmond. Now, Dr. Gulati is the chief of cardiology at the hospital where he works. And I'm particularly interested to get his perspective as somebody who's a medical practitioner. So very exciting perspectives that we're going to try and bring to you today. My name is Shruti Advani, and I'm going to try and bring you my own perspective as somebody who's trying to practice spirituality while living in a very material world. So I'm looking forward to this discussion. Deepa, I'm going to come to you first to hear about your experience.
Great. Thank you very much for having me here. It's really wonderful to be on this platform. And I'm looking forward to sharing my experiences and my whole entire learning process. I mean, whatever I can say to you. It's been a very truly beautiful and amazing experience for me. And I have learned, and I've been practicing the meditation, the lotus meditation, which I've learned from Tarini for the past 18 years. I've also done the empowerment program with her. And I must say, I have seen and I've felt tremendous changes in my life and in all aspects. So dealing with my mind, my thoughts, clarity of thoughts, that's what it's given me. Dealing with my relationships, dealing with, fears. On the whole, I'd say it's kind of emotionally balanced me. But I must say, for me, the biggest take on this whole thing was learning to love and respect myself.
That's the big one.
And yes. And forming and creating my boundaries for myself.
I'm going meditation, to because you brought in such a big point, both of which are valid to anybody who's not just on this path, but living in this world, right? Learning to love oneself and setting boundaries are both things that I think anyone listening into this conversation will identify with. But I did want to ask you, on your meditation practice, how long is it that you devote to meditating? Is this something you do every day, as often as you can, once a week? How long and how frequent?
Okay, so that's the beauty of this. There are no rules. There is no pressure. I mean, I'm the kind of person, I can't take pressure at all. So if I found any form of pressure, any kind of pressure, I'd run the other way. But this was very free flowing. It's about you. Tarini has taught it to us. But there are no rules that you have to sit down at 9 o'clock in the morning and close your eyes and do this. No, no, no. I'm not a person like that. It's up to you. You can sit down whenever you want, whatever time of day you want. And you can do it. I sometimes do it for 3 minutes, sometimes 10 minutes, but the result is the same.
It's incredible.
Like Tarini says, it's always the intent. It's your purity of intent. And that's what works. I mean, today I have to tell you, meditation is a part of me. It is me. I would love to have this. It is part of my character, my personality, my nature now. I don't think I could have a single day without doing my meditation. It's like, having a shower every day. I have to meditate. And I've had the most wonderful experiences at the retreats, at the empowerment program. I made wonderful friends. We had great laughter. We had good times. I got to see places which I would never, ever have gone to or made the effort to go to otherwise. And it's truly been a very humbling process. And I am so grateful for it. I can't tell you.
I think it's such a powerful one where you said that meditation for you can be 20, it can be 10 minutes, and that the impact that you feel is the same. And I think the point you've made is such a powerful one. I'm a mom of two, and I speak with a lot of mom friends who are sort of harrowed between doing the school run and preparing for GCSEs and planning meals and pursuing your own career and working on your relationships. And they don't believe they have the time to meditate. And so I think it's such a powerful message that there aren't any rules. You don't have to cross your feet and sit in an asana at 6 a.m. and watch the sunrise and have absolute quiet around you. And I do think that's what's very powerful about the method that Tarini teaches, that it is your method and it is your path rather than one that is prescribed to you.
Yes, definitely, for sure. I mean, I started this when I have two sons, and my youngest one was 2 years old, and the older one was 5. And I wish we could have them sit here with you, because they would tell you how mums changed over the years. And they sometimes tell me, Mom, can you go and meditate, please? It's time to meditate. And
fantastic. So they recognize the impact it's had already. Can you tell us a little about these changes? I know you identified 2 as the major ones. You said that it's helped you establish boundaries and stick to them, but also then the big one, you brought up self-love and how meditation has introduced you to self-love. Can you talk to us about both of those?
Self-love. I mean, it was a phrase I'd heard of, but it was a very no phrase. You have to learn and respect others, put everyone else first, and then put yourself. I mean, those are the values and virtues and everything that we're taught. So it's always you never tend to love yourself. You're like, no, I've got to make everybody else happy. I don't really matter. So even sometimes when you cannot say no, I mean, you want to say no, you end up saying yes. And it doesn't work. It doesn't happen because you're not totally into it. You don't want to do it. But I could never say no. Anyone would call me and ask me for a favor, my parents, my family, my children, all those obligations, everything. I could not say no because I was always taught, you have to please the other first. This was a big thing that I learned when Tarini taught us in meditation, that if you don't learn to be happy with what you're doing, you can never make anything or anyone else happy. You have to be happy first. You have to be able to do it willingly, happily. And then that vibration comes out. So those were the steps in learning to love yourself. It was very, very difficult. I must tell you, it was very difficult. because the mind has been trained that way. And it was like an unlearning of the mind. We had to unlearn the entire process to come back and say no. It was so difficult. I had to practice sometimes in my mind. No, I am not happy doing this. I am not going to do this. So I shall say no. But gradually, over the years, through the meditation, as you get your clarity of thoughts, you learn and you accept the situation and you say, no, I will not do this. And that makes you so happy. And whatever you do it with your heart, you do it with the purity of intent, and it always turns out right. And the vibration comes out right. It's all about self-respect, self-love. You have to think of yourself first. It sounds very odd. I mean, if I had to tell somebody else this, they'd be like, oh my God, she's so selfish. But it doesn't work that way.
How did people around you react? Because one is you're having this realization, but also you're the one who's meditating, having these insights. It doesn't mean everyone around you is also meditating and having these insights and saying, oh, that's great, Deepa. I'm glad you're putting in place boundaries. I'm sure reactions around you to these new boundaries that you were trying to put in place were mixed.
Yes, they were mixed, but as you meditate, your vibration also changes. And it's like Tarini's taught us. Communication is 95% of vibration and only 5% of actual physical communication. And yes, people have seen me evolve. Everyone around me has seen me evolve. And I love it.
Is there an area that you find it difficult to hold onto your boundaries in today, despite all of the work and the progress you've made? Does there continue to be an area which is a challenge for you?
Today, at this point, I can proudly say no. But you never know. I mean, tomorrow's a new day. There might be a challenge. There might be something that comes up, which would be difficult, yes. But at the moment, no. I do not do it. I'm very clear about my boundaries. It's taken me a very, very long time to reach this point. But today I can proudly say no. I do not have that at the moment.
That's so heartening, Deepa. And it's a fantastic note for me to now ask Jessie to join this discussion and give us some perspective, Jessie, because your sort of entry into this space really was on a professional note. And then the professional started spilling over into the personal.
It did. And I feel incredibly grateful to be here today. So thank you. So Tarini and I met almost exactly 4 years ago. And yes, the entry point into our relationship was professional. And I came on to help with the writing of her website. And that very quickly evolved from a professional writing relationship into a friendship, and then into a healing and very connected relationship. I felt immediately drawn to Tarini and her warmth and her energy, and began doing one-on-one coaching and entering into the healing room, and really looking at things that I hadn't, let me take that back. I hadn't looked at. It's a lot of trauma, as there is for so many of us today in my past. Began in utero. You know, my father almost died right after my parents found out they were pregnant with me, and they were young. My mother almost died giving birth to me. And my childhood, you could call it unstable and tumultuous at best. And I carried a lot of that into my adult life. And while I achieved a lot of success professionally, my relationships were, particularly with men, romantic relationships were abusive. in a lot of ways. I really gravitated toward abusive relationships, would engage in a lot of self-sabotaging behavior. Really did struggle too with this self-love, but wasn't even realizing that that was at the crux of it all. And had done a lot of therapy. When I say a lot, I mean a lot. I mean, even professionally, you know, I was trained as an environmental journalist, and I really gravitated more toward working with therapists and coaches and healers, because I firmly believe that our planet's in trauma, because so many of us are, right? And we're dealing with the manifestations of that, whether it's addictions or depression or anxiety. So in all the work that I had done over all of these years, and a lot of it was helpful, but I still found myself stuck in these same cycles and in these same patterns. And with that came a lot of frustration, a lot of unexpressed anger. But on the outside, you know, I'm vivacious and everything looked great, until it didn't. And entering into this work with Tarini was so highly transformative, and it happened quickly too. Tarini has this uncanny ability to, and maybe it is because of how intuitive and warm she is, but to really get right into those blockages. And whether it was in one-on-one coaching or entering into the healing room with her, it so much began to unravel for me so quickly, and really went right to the root of these abandonment issues, right? And these feelings of rejection, and these feelings of I don't deserve this happiness, right? And this contentment. And realizing that I was so unexpressed out of fear. I think the underlying piece was fear. And rather than coming from a place of love, I was often coming from a place of fear.
As
And that was
a lot of people when dealing with an emotion as strong as anger. You referred earlier to this unexpressed anger that was still showing up in your life. And I think for a lot of people, they're very afraid of what you and I might refer to as the path, because it's like this tightly screwed bottle, and all of the emotions are so neatly but tightly packed in, and you're afraid you'll take the lid off and the whole thing will just blow up.
Oh yeah. Yeah, and that happened a couple of times. It's contained until it's not. And then with that,
like when it blows up in your face, what does that look like? And I think it's important to know that even if that happens, there's a tomorrow, and you get on the other side of that process. You let those emotions out, you experience the anger, but then there is another side.
Absolutely. And I think that there is a place for anger. I think when I first started working with Tarini, I hadn't expressed anger in almost 2 years. I was terrified of it. So then though, when it would come up it was very explosive. It was explosive for the people around me, for myself, just this uncontained, well, it was so contained. And in working with Tarini though, I mean, there's a place for all emotions, right? There's a place for it all. I think I was also trying so hard to control everything, right? Rather than being with the flow of what is, and experiencing that sort of freedom of self. So through this work, and again, it happened so incredibly quickly. You know, I mean, Tarini and I were at that point between working professionally and doing this healing work. We were talking, I would say 2 to 3 times a week at this point. And, you know, it's a little after 6 o'clock in the morning with the time difference, right? I was excited to get up early, right? I was excited to get up at 5 o'clock in the morning with or before the sun, to work with Tarini. And through this work, and it's hard for me to articulate, because what she does is so different than anything I'd done with any other therapist, or coach or healer.
I see, because you've said it happened really quickly, and you're in the privileged position of having had access to different paths. And so you've tried traditional therapy, and you said you tried that and you gave it a fair try. It's something you tried for years. So give me a comparison on what did the process look like, and what do you mean by quickly? Because to a lot of people, 4 years will sound like a long time.
Well, this didn't happen in 4 years. I've known Tarini for 4 years. This, I would say, was over the course of a couple of months of engaging in this deep work. And the difference, and when I say I've done a lot of therapy, I've really I've done a lot, from cognitive behavioral therapy to yoga therapy to you name it, to a lot of trauma therapy. And where I definitely felt some improvements with Tarini, I think it's the energetic piece of it. It's also she brings a practicality to it. It's so multifaceted. And she's got this just beautiful, unique approach. I also think part of it is her, right? And her ability to really feel in to what the presenting problems are, the issues, right? The blockages. And to bring that to the surface and to really create a space for expression. I think that was a big thing. And to tap into these pieces of how I was conditioned, how I was behaving, that had been so unexpressed and not identified for so long. And once brought up, the clearing became, it was, the word's not easy, because it wasn't easy, right? But it was flowing, right? And these feelings of abandonment and rejection that I had been carrying for so long, that really, I guess, were manifesting in my inability to trust. And today, years after doing this work with Tarini, my life is not without challenge or strife. Particularly, 2020 hasn't been an easy year for anyone in any way, but things that I feel like would have brought me to my knees, or caused panic and anxiety years ago, I'm able to flow with, and sometimes almost just witness, right? And stay in this just place of like emotional self-regulation, self-love, and forgiveness too. When I first started working with Tarini, I didn't believe that it would be possible for me to forgive my parents. I have a phenomenal relationship with my father today. My mother still might, hold her a little bit at arm's length, but it becomes more and more loving, and far more detached. And when I first started working with Tarini on this sort of stuff, the idea of detachment felt very foreign to me. Well, of course, I'm attached to my children and to these ideas and these stories, and certainly to the patterns and cycles, right, that weren't bringing me joy. But in letting go of it, and while still being an active participant in my life, but going with the flow of things, comes this incredible sense of freedom, and understanding the impermanence of it all too. Because yeah, it is, things shift, and rather than trying to control things, as I used to be very good at, and I still am working on that, being with it, just being with it, has brought a lot of, just like I said, freedom, contentment, and joy into my life.
Did you ever feel any pressure to choose during the process between one or the other part? Did you look back on your years in therapy and say, oh, well, that was a waste of time? Or did you see it as something that prepared the ground or helped you get to that state where you were ripe?
No, I never thought that any of the therapy that I engaged in was a waste of time. And, it was all exercises in unraveling and learning and growing and developing more resources and skills. And I've worked with incredible therapists. I get to professionally and personally. So when I think all of the work that I had done up until meeting Tarini had really put me in a place where I was very open I was very open to doing this work. I was really tired of being tired too. I was really tired of repeating these patterns, finding myself, oh my gosh, here I am again, right? Different relationships, same dynamic. And really understanding that the common denominator in all of this, though, was myself.
I'm going to reiterate two things that you said that really spoke to me, and I think they're incredibly powerful. One was the point you just made about it doesn't have to be this way. And I thought, wow, that in a sentence is empowerment for everyone.
Absolutely.
When you realize you have a choice, when it isn't prescripted, when your reactions aren't hardwired because of past trauma or certain DNA or certain karma, but when in that moment you say, wait a minute, I will choose now how I react to this. And I just thought, when you said that, I just thought, wow, that's empowerment. And the other point that really spoke to me, perhaps because of my own experience, was the freedom that we're all allowed when working with Tarini to choose our own paths. And our own paths may well turn out to be an amalgamation of her path and some other path, as long as it speaks to us. I mean, I've been working with Tarini for many, many years, and recently started seeing a therapist, so a traditional therapeutic relationship with a doctor. And I think it's something that most people who have regular practices would struggle to disclose to their guides, because there would be a sense of, well, if you found what you're looking for with me, then why do you need this? And I was blown away by how supportive Tarini was of my desire to see a traditional therapist, how supportive my spiritual guides process was of that therapeutic relationship, how I could very freely discuss ideas that had perhaps come up in therapy and extrapolate and explore them in my work with Tarini. And I just anecdotally, from speaking with other people who are either in therapy or who are on a path, I didn't find any that had found a synchronicity between the two. Most felt, well, it's either or. And that to me was incredibly liberating, to have someone that says, well, let's talk about that and let's see how you can use that to enhance this process, rather than someone who shuts that door and says, well, this is not my path. And so if you choose to go down it, I won't be supporting you. And to me, that was just, I feel at that point, growth became exponential rather than iterative. So thank you.
Yeah, I resonate. And that's a beautiful.
It
really
is. I'm incredibly grateful for that.
Yeah,
I'm also very excited to bring in the Gulatis. I introduced them earlier. We've got Tanu and Dr. Sanjeev Gulati. And the reason I'm excited to get both of their perspectives in is because they're here to speak to us today about an experience that they had with their 16-year-old son. And as a mother, I'm very intrigued to hear your perspective, Tanu, as a mother, but as a moderator of this panel, I'm also very intrigued to hear Dr. Gulati's perspective on his doctor's cap, so to speak.
Hello, everyone. We're also so incredibly thankful and beyond humble to be a part of this and to be to know Tarini K. She has changed our world and continues to. We have only known her for a little over a year, actually. Just to give you a little background, my life, I think I felt a little lost, like many of us who are searching for their path on their journey. we've had a lot of loss in our life. And so I think that loss translated to me taking on a lot of burden, or responsibility, or blame, shame, guilt, all of the above. And so I was like those, I'm brought up in America, but very, very Indian at heart. I'm Indian American, spiritual, all of the above. But I started to go on a journey to find, peace, and had gone to India. A family member of mine connected me to Tarini K, and we began what I feel like when I first spoke to her, I felt like I was home. And that was just a little over a year ago. And so, and then it began. And so just being able to open up to her and feel unjudged, and loved from the start, understood, and heard. This is just very validating. So sweet. Anyway, so felt very heard. Being heard is so important in life. So at that time, we had lost both fathers, and our son, who's 16, we have two boys. One is 13, one is 16. Our older son, Sage, has been suffering from severe depression and anxiety. He's always been, we would say when he was born, he's like 100-year-old man, like with the 3 wrinkles, and always very just pensive. And so there was something different about him from the day he was born. And there were so many things that I need to work on, continue to work on, and began to work on with Tarini K. But it just sort of organically kind of started to bring us on the path of working on Seiji, our son, and through our relationship and our struggles and our challenges and our family's challenges. And so when in the healing room, we would find all these very deep, sort of dark energies with our son, and surrounding our son. And he was carrying so much family, ancestral karma, and it's unreal. It's definitely everything in the universe it's intentional. The relationships are intentional. We started working immediately, intensely, for hours and hours a week on all of the different parts of our family's journey, really to sort of focus in on Sage. So to cut to what the event that sort of culminated this year into it, we believe we were connected to Tarini K really for this event, for her to be in our world and his life during this event. February 7th, I'm gonna let my husband speak, but I was the one who was home. He was at a medical conference, and I was walking from my bedroom to the kitchen. My son had been sick that week. He'd not been well. I had done a healing session with Tarini K on that Wednesday, and this was Friday morning, February 7th. And I walked and we had done a healing session on Sage. And I was walking from my room to the kitchen, and I could hear this very different noise, very strong, very deep. Couldn't recognize what it was. I went to the top platform of the stairs and ran into my son's room, and he was aspirating. He was in an active grand mal seizure. He was unconscious, vomit everywhere. And I ran down to my other son's room, said, "You need to FaceTime Daddy, and I'm gonna call 911 and just work with me. I don't know what's happening. I don't know if your brother's okay. And he was immediate, like, is he going to make it, Mommy? And I said, I don't know. Well, let's just see. Anyway, so we ran back to the room. I called the paramedics. We walked through what we needed to do. They were here within 8 or 9 minutes. They then I'm gonna let you step in. He was on FaceTime.
So my younger son FaceTimed me while Thanu was on the phone with the people for the ambulance, and they were coming in, and I could hear and see a little bit of what was going on. And like Thanu said, Sage was unconscious. He had a seizure, and they thought he was still probably seizing, and his breathing was not normal. So they were trying to stabilize his breathing They were trying to give him some medications to see if they could give it to stop what they thought were seizures. And at that time, quickly
Has this happened before? Did Sage ever have a
no,
seizure before prior to this?
yeah,
No.
that's a great question. No, he's never had seizures before, and like Benu said, that week preceding going into that Friday, he'd been ill with probably a viral. We thought was something viral related. He had fevers. His stomach didn't feel good. He just didn't feel well. Going into this, so the thought was, did he get sick to his stomach and vomit and then cause the seizure?
He was on an anti-anxiety medication by the name of Effexor, and his dose had just been increased, and that medication in a small 2% population can create seizures if there's a fever, if everything aligns to that. So fever, stomach sickness, vomiting, and
yeah, I mean, everything related could be, the
Yeah.
combination of symptoms he was having, we were thinking was related to that combination of the medication as well as the infection that he may have been having, the virus that causes fevers and things like that.
So unfortunately, just a perfect storm.
Yes, yeah.
Exactly.
He was taken by the paramedics directly to the emergency room. Sanjeev was trying to get back from the DC area. And as soon as he got to the emergency room, they sedated him and intubated him because he was having a seizure the entire time there. I actually was in the car behind. The whole town was a little quiet, and there was no one else in the emergency room, which is unheard of. It's a big pediatric emergency hospital. It's a pediatric hospital. Levine Children's is well known, and it's never empty. It was empty. Every single member of that staff was working on him. So they intubated him, they sedated him, they took him for a CT scan to see if there was a brain hemorrhage or any aneurysm in his brain. There was not. At this point, they had a neurologist. His liver was failing, his kidney was failing, his every organ had issues. His lungs were obstructed.
Yeah, and at the same time, his heart was failing. While they were in the emergency room, they decided to do a lumbar puncture, worried about meningitis. And as they completed that, then he had a cardiac arrest, which was witnessed by the ICU doctor that took care of him, as well as the emergency room doctor. Both were in the room at that time and recognized it by seeing the monitor, and immediately started doing CPR and trying to resuscitate him with medications to get his heart to start to work again.
His heart stopped for more than 11 minutes.
And during
What
this,
are you thinking as a cardiologist on the other end of that phone?
Well, so this is the beautiful part.
yeah, so the interesting thing is, and Tanu's not telling you this, truthfully, she was much more like a lot of moms in that mode of taking care of everything. So she was completely emotionally, I would say, in shock on some level, but at the same time was doing everything that needed to be done, taking care of our younger son, communicating with the doctors. And you can imagine it was pretty chaotic, and all these doctors and nurses were coming at her with information, and all the information at that time was very negative. Things were failing. He was doing worse. He was not stable. They were at the same time saying, you may need to come back to the emergency room to see him. And all those things are not good signs when you're in the medical field, when you're telling families those things. I'm rushing to the airport, and like Thanu said, because of the weather, there was delays, and there was other delays to get here. I was desperate, trying to call my physician colleagues that I knew to get to the emergency room to help take care of Thanu and Sage and make sure things were going okay, so that I had people I trusted that were telling me what was going on, because from a medical standpoint, things didn't sound good. And then as a father, I was an emotional wreck. And it was very difficult to have that conversation, on the phone. And so as I was getting to, I think it was, I don't remember exactly because I was in shock myself a little bit, but I think it was as I was at the airport trying to get on to the plane that I called T, and I told her, and I through Thanu actually, because they were obviously, like she mentioned, had this relationship, and she was doing some healing, and so Thanu introduced me to T before this, and I'd started doing some sessions with her, but I immediately called her and I said, "This is what's."
Thought that made you call her? Because I'm going to ask you about that for just a minute, because it's so unconventional for a cardiologist to have a patient leave alone his own son in distress, medical distress, and say, I've got the best medical help for him that I can, i.e., I'm making sure my colleagues are in that room working on him. I'm now going to call somebody with a healing perspective on this.
Yeah, and Shruti, you don't know me, but that is not my wheelhouse.
That's actually what I was going to say. And you don't even know that he would never in a million years ever prior to meeting Tarini G ever even consider calling anyone in the realm of, but
yeah, I would never
quickly became so grateful to have her in our world. I mean,
yeah, and a lot of it is, as you can tell, Tanu is very spiritual, and over the years, she's talked about spirituality and the connection between the spiritual world and the physical world
in the medical world,
right, and all those, how they all play together. And I think that kind of philosophy has rubbed off on me from Tanu. But as she was saying, as her relationship developed with T, and she was telling me a lot of her sessions with T, and again, not being completely buying into that, I would always question her, and I would kind of push back, is this really true? And then she introduced me to T, and I had some sessions, and some of them were really amazing. And when I heard things that that Tanu had gone through with T, and knowing Tanu and her history and her background, some of them just were overwhelming to me to hear how T could put these things together, and things would come to fruition. And so that really, I think, ultimately for me, in somewhere in the back of my mind, I was believing this and feeling this. And so, to your point, as I was feeling very helpless not being there, it's not that I could have done anything probably if I was here, but feeling that very helpless concern for Tanu and Sage and our younger son Cyan, that everybody was going through their own real severe trauma. It made me want to add more expertise, if you will, to the care of my family. And I don't even actually know what triggered it, but immediately I called T and I told her what was going on. And I said, I'm struggling to get to the airport. Tanu's in the emergency room. My younger son's there. And obviously I kind of gave her everything that was going on with Sage. Without missing a beat, she basically said, she said, I'll stop everything, and I'm going to get into the healing room and start doing healing for Sage to get him through this.
Well, so that's the beautiful part. Then when you said, so he stopped and actually thought of Tarini G, which is beautiful, because even it would be something I would normally have done, but I think I was in I was in this mode of go, go, go. And then I think when I did step outside to call Tarini G only after they were able to get his heart pumping again. And she knew everything. And it just, once again, I felt like I was home. And I exhaled and I cried. And she knew everything that was already going on. And she could see it on an energetic level. And she could speak to him on an energetic level. And she was, from then on, we had the medical team here, but we had the medical healing team on the other end with Tarini G. And there is no way that child would be here today if both teams weren't working together. I mean, she's unbelievably amazing. And we are we don't have enough words. There are no words to describe, but that she could go along with us. Clinically, what was happening in the emergency room, she could see in the healing room. So his acid levels were very high. They were very elevated. And in order for his heart to beat, go ahead, step in this.
Yeah. So, with all the, when his heart stopped working and his other organs weren't working, there's this tremendous buildup of acid that naturally occurs. And then the body that acid actually makes the organs work even worse. So it actually kind of is a big bad cycle. And that's when she could see that this acid buildup was going on and that it needed to be removed. And, these are the things that need to happen. And
they took him from the emergency room, finally stabilized him after the cardiac arrest. Well, ironically, when Sanjeev called Tarini G, she actually stepped in just before the cardiac arrest. So she was able to already be in the healing room during that process, which there's no doubt in our minds, this is what gave him the strength to come back and fight. Once they stabilized, their whole goal in the emergency room is to get him to the ICU so they could have everything at their fingertips. So again, Sanjeev is at the airport. They're still trying to well, actually, when he had the cardiac arrest, Sanjeev was almost in the air. So after that, the heart and lung transplant team, the ECMO team, which is all part of Sanjeev's group, they came and they introduced themselves to me. They would have had to put him on a heart and lung machine. So that's never good. It's very hard for anybody to bounce back off of that. They did not have to do that. They did take him upstairs to the ICU. Once they took him to the ICU, they had him connected to all of the EEG machine to monitor his seizure, heart, lung.
Yeah, he was on the ventilator. He was on the EEG machine to look for seizures.
They cooled his body.
Yeah, so one of the things they did was cool him to protect his brain and his other organs, so reducing his temperature very low, which helps preserve the organs, particularly the brain. And then he was on several medications to support his blood pressure. His blood pressure remained low and dangerously low for hours, and which was also leading to more damage of his organs at that time.
Tarini, you could see everything in the healing room. He was not wanting to come back. He was giving up. I don't even know, actually, I don't even know all the details because I was in the hospital all the time. She was 24 hours a day, every day, working on this. And we're so, grateful is not even the right word, but she, along with the medical doctors, I could see everything clinically, had said, there's too much, there are toxins, there's too much. She could see the medication. So he was taken off the ventilator. And then immediately, almost acting like someone he was strapped down by 9 people because he was delirious
and confused and agitated and moving around. And there were many hours of either multiple people trying to hold him down, giving him medications to sedate him, because his brain wasn't back to kind of where he could even understand where he was during that time.
And so
so this is what's happening physically in the hospital. And what's happening, were either of you in touch with Tarini, and what was happening on that end? And did the two sort of in any way meet? Was there something similar between the process that was going on physically in front of you? And
no, that's what I'm saying. It was exactly, everything was this. They were simultaneously working together. She could see everything in real time. She would know. So I didn't know how many minutes his heart had stopped. She did. She could tell me. She already knew. I said, I think it's a little over 10 minutes. And she said, I think it's actually a little bit 11 something. And she was right. And then when his body was being cooled, she could even see, there's probably so much she hasn't even had a chance to download and let me, detail by detail, let me know. And as she was healing, we would see the improvements on this side. So medically, they were doing what they needed to do, but her healing was already sort of the catalyst for things, I think, moving forward, even on the medical side. I have had many conversations with her about this, but I genuinely believe that there's a huge gap in medical care. There needs to be medical healing and medical care being done simultaneously. We witnessed it. And it's really hard to put into words or to explain when you are watching your child have what does you call this shock,
defibrillation.
The defibrillator. And you're watching, and you have no idea that the healing room is already in session. I did not know, and no one thought he was going to come back. There are probably 25 to 30 people in that bay in the emergency room with me, with tears in their eyes, because their colleague's son has come in, and it was just, and then so. Then I step outside and I understand that Tarini's already in the healing room, and she saw it and she knew how many minutes, and then that was it. I didn't even know in my mind that experience is something that could happen in the healing room. I mean, I knew, but you don't know when you're thrown into those circumstances. And then that's it. I surrendered to the healing room, and she would say, "This is what I've seen. How is it going there?" And I would say, I would give her the rundown of all the numbers, very clinical and beautiful. I mean, sorry,
Yeah, no, I think that
Did that make it more palatable for you? Because until recently, you were one of those 25 medical professionals in that bay working on a patient, and things are not going well. Medically, the parameters are not looking good, as you said. And then there's this dramatic U-turn. How would you have viewed it? And how did you view it differently this time? What did you think was going on?
I think that if I didn't know about T and that whole aspect of what was going on in parallel, I wouldn't have an answer. And I'll tell you that the doctors that took care of him, for lack of a better term, because they didn't know we were using T and having this healing spiritual component during that time, they thought this was all a miracle. They first of all
they
thought,
still think.
yeah, they thought that he wasn't going to make it. And the fact that not only he
Yeah.
made it, but he recovered and fully recovered,
He's 100% recovery.
like everything is back to normal: kidneys, liver, heart, brain.
Uh,
We just took him back to two of the main doctors that worked on him. And one of the doctors, she's very spiritual and religious, and she said she'd been praying for him and on her own, even as this whole process was going on while he was in the hospital. And she still says this is a miracle, and she looks at him and can't believe. And she's a pediatric ER doctor, so she
She
sees
was
this
the
all the time.
yeah.
And same with the ICU doctor. They just couldn't believe it. And so I think, from a clinical standpoint, we would use the term miracle. We don't understand what happened and how sick he got and how much quicker, everybody says, oh, kids get better, but this was not the normal, even from
No,
hearing
no.
them, this was
Yeah.
not what they would have expected as the outcome. And so,
No, the entire team came by when he was on the floor, on the recovery floor. Every single person that worked on him came by to get a picture with him. They still to this day,
As
when
miracle child.
yeah, absolutely, especially with the 100% recovery. I mean, that was February, because then everybody went into lockdown, and then in May he had his finals. He topped all of his exams, and he got the highest score in his AP US history. I mean, it's not anything short of a. It is a true. There's medical miracles, and then there's true miracles.
Shruti, like you asked, what was I thinking? Why would I call T? And Thunun has asked me this before we even got on this call today. Like, what really made you, pick up the phone and do that? Because that's not my normal personality or view. And
Because you're the guy we would normally call. If one passes in this situation, we're calling you.
Right. And I think that, maybe I don't know if it's as a physician or as a dad, probably more as a dad, when you start to see something going in this direction. And I see Tanu, she pulls out all the stops when it comes to our children. If there's something that needs to be done, that mom has that life-saving core feeling, and you start grabbing for anything you need to do. You don't care what it needs to save your child. And I think in that level, as I'm calling all my colleagues, she's in the emergency room, managing all of that. It was almost reaching to the shelf and getting the next important aspect of this. And that was T, just like I would reach for life-saving medication. I think that whole combination of things is probably subconsciously why I said, why it came into my mind even to call T.
Yeah.
That was I still look back, and when she was asking me today, I don't know what consciously made me do it, but subconsciously it just felt natural to call her and say, this is the situation, we need your help. And again, without missing a beat, she took over and did her clinical work to help us and help Sage.
She is very clinical in her reaction. I mean, I've seen her react to medical emergencies before, and she is extremely clinical in her reaction. It's almost like someone who's been through medical training of their own, because they respond like a physician would in a very matter of fact and detailed manner.
Right.
You use that term, Danu, because is that a conversation you think you could have with the medical profession? It's certainly a conversation that the spiritual seekers amongst us will be very interested in. And I know you're sharing this experience, as painful as it has been for you to revisit it today, will spark a lot of thought and conversation for a lot of us. But what about the medical profession? I would love for there to be. I was a hospital administrator. That's my background. I'm not working right now, but I would love for there to be some awareness brought in to the medical world to understand that they need that partnership, because there is no other partnership. I mean, you cannot go into healing. That is also healing.
And energetically, there should be no other way, and it would be my greatest wish to see Tarini G be sort of the pioneer of that, because her way, I mean, her voice in itself heals, and so medically and spiritually, she could make a huge impact. And anyone that follows in those footsteps of hers, because don't you agree now? I'm sorry, I talk so much, but as a clinician who leads all these clinicians, I mean, you can see that they're.
Yeah, and I think that, Western medicine is very conservative. And so if they can't measure it, they don't believe it. And that this is a different type of measurement that I think, T is like a pioneer in trying to bridge that Eastern and Western, for lack of a better term, kind of philosophies. And you see in America now that there is more of a movement to non-traditional kind of clinical medicine, of wellness for doctors, and wellness as a holistic way for families, and even the way hospitals are being built now are taking into account the spiritual and the psychological, the things that we would never take, 10 years ago would never been looked at. So I think there's so much opportunity as we have new and young physicians coming on and taking care of people, that this type of work could easily blend in and be another way to help take care of the patient themselves and their family. I think that's the other part of it, is that with T, I mean, she was amazing to help Sage, but I think she helped the two of us get through something that I would never wish on any family. And that's actually really important when you look at even just Western medicine, is we don't pay attention to the other people in the family who have gone through this trauma, have this post-traumatic stress disorder kind of feeling. For a long time when Sage was home, we couldn't sleep because we would check on him in the middle of the night just to make sure he was okay.
Yeah.
And just, and those sort of things are also just as important for Sage's healing as for us to be stronger and better for him. It's a synergistic effect. And so, I mean, she was invaluable in, helping us as a family get through this, and it was amazing to help Sage heal primarily, and then help our family begin to heal.
So how can you heal medically without healing?
2020 has been a year of so many firsts, and I think so many of us have been humbled by everything that has gone down this year, that if ever there's been a time for a paradigm shift, if ever there's been a time for us to try a new approach, because clearly the old one is not able to continue. I'm hoping that this is it. I'm hoping that this is the time that we will wake up to, as you say, a more holistic approach. Thank you so much, everyone, for joining me today. The conversations have been incredible. Thank you for sharing what I know.